We're rolling out technology across the NHS to help both staff and patients. But I also want to bring care closer to us as patients. And this includes our Pharmacy First programme, which we launched in January and has been really, has had really confident start. I want to expand Pharmacy First because it's good for patients walking in off the street for the 7 most basic conditions. We're going to increase the number of conditions that pharmacists can look after. It's also good for pharmacists because we want to use these highly skilled professionals to the top of their licence. But there's even more to this announcement today, because we're rebuilding GP surgeries and CDCs.
Just unpack what you've just said.
Right.
It's great for pharmacists. You're giving them more work and less money.
Well, that's not correct, because we have funded Pharmacy First to the tune of £645 million. We've seen already a good take-up. You know, we've got to scale it up. We all accept that, because we've all got to understand that if we have got earache or a sore throat or sinusitis, then we can go to our pharmacist rather than speaking to our GP. That frees up GP appointments as well for more serious conditions. But we also, of course, this is funded. This expansion will be funded as well. And we're doing it in a really interesting and thoughtful way, because we understand during the pandemic we had a huge increase in managers because the NHS had to cope with that.
But you know, you're saying this, but you know that pharmacists are saying, yeah, we'd love to do more work, but actually we literally can't afford it. And you can't force them to do it, can you?
Well, I have to say, every pharmacist I've visited have seized the opportunity of Pharmacy First. We know that some 98% of pharmacists have, in fact, taken up Pharmacy First. And in the first month of it being rolled out, some 120,000 appointments were conducted by pharmacists. So that's great
but that's
news.
tiny by comparison to what you're promising. You're promising to free up 20 million appointments, 120,000. And I know you say in the press release when it's scaled up. You don't give us you don't give us a time scale. When do you expect to have these 20 million appointments?
By the end of the next Parliament. And so part of
next 5 years.
Part of my job is to help people understand that if they have the 7 conditions, if, for example, they are a woman and they have a simple urinary tract infection, then they can go to their pharmacist. They don't need to go to their GP. If they have shingles, if someone has shingles, they can go to their pharmacist. And we're extending these services now so that women can access contraceptive services from their pharmacist, but also menopause help. That's really significant, I think, for, you know, rather than having to queue up, freeing up GPs, but also helping patients. And we're adding chest and skin infections to this list as well. All of this, I underline, is based on clinical advice. You know, of course, a GP will always be there if needed for more serious iterations of these conditions. It's about using our community services more imaginatively.